Dr. James Greenblatt is a dual board certified psychiatrist and leading pioneer in functional and integrative psychiatry. He's known for his groundbreaking work with low dose nutritional lithium, and he has spent more than 30 years advancing precision based approaches that address the root causes of mental illness. He earned his medical degree and completed his psychiatry training at George Washington University, followed by a fellowship in child and adolescent psychiatry at Johns Hopkins. He now serves as an assistant clinical professor of psychiatry at Tufts University School of Medicine and Dartmouth's Giesel School of Medicine. He's the author of 9 books, including the upcoming Finally Hopeful, so go and get that book. And he founded Psychiatry Redefined, which is a global training platform for clinicians. He's a sought after speaker. He lectures internationally on nutritional psychiatry and functional medicine in mental health. And he is just also a really sweet, amazing person. So we're really excited to have you listen to this episode. Let's get into it.
I'd love to begin by asking about you and your why. Why are you here today? Why have you done all of these decades of trailblazing? Tell me about the person behind all of this creation.
Sure. Thank you, and thanks for inviting me on the show. I think always wanted to be a doctor. I think we go back to first grade watching doctor shows on TV. So that part was simple. And then I became interested in health and nutrition in my adolescence and teens. And I went to medical school and I thought I was going to cure the world with brown rice and kale. And that was going to be the answer to man's kind's problems. And then I came out 9 years later as a child psychopharmacologist,
Yeah.
So I did child psychiatry training and most of that was, therapy and meds. So very quickly in private practice, I realized meds were not the answer, and I slowly got back into the roots of why I went to medicine, nutrition and brain function. And that's been my career now for 30 years, bridging traditional psychiatry with a more holistic naturopathic approach.
So it started with one dream, and then that dream evolved. And psychopharmacology, for those who are listening that haven't heard that word, what is that unique approach?
It's just medications, prescribing medicines to children and adults for mental health diagnoses and challenges. And it's a really important term because medications can be life-saving for many individuals. But I think the field of psychiatry, which I'm part of, has gone overboard. And now there's a term called polypharmacy, where people are prescribed not one, not two, but many individuals struggling with psychiatric disorders are prescribed 5 and 6 different medications. So we have the
Yeah.
term psychopharmacology is medications for psychiatric illness, and polypharmacy, multiple medications. And it's really a tragedy.
It's interesting too with that 2022 meta-analysis that came out, which by and large debunked the chemical imbalance theory, and where this began in the 40s, 50s, 60s, where low serotonin people feel less happy. We give them a medication that increases serotonin, they feel more happy. Therefore, serotonin levels must be the root of our mental health. And then we had all these decades that followed where the primary approach to mental health was psychopharmacology. It was using medications. And so, where were you in your career at this time? I imagine that this was no surprise to you, and you'd already been doing other types of work. Kind of talk to me about that.
Sure, I was just coming out of training, right when the Prozac came out, and it was this first opportunity where there was a more safer medication than the medicines we were using. And there was this wonderful marketing tool here, low serotonin. We have a medicine that's going to help. And the ads when it came out is this is going to improve your life and this is going to, increase your self-esteem. And so I came out right when that, you know, excitement developed, but also waited, 5 years for the Prozac backlash and all the TV shows on survivors of Prozac.
Yeah.
But it did sell medicine. We had a theory, low serotonin. We have a medicine to increase it. And so it was great for pharmaceutical companies, but I think it was the beginning of havoc for psychiatry.
Yeah.
Absolutely. Yeah, and I'm curious about you said that you went into medical school being like, I'm gonna cure the world with kale and brown rice. Was there something from like your childhood or in college where you were like, no, this is like root cause is what I'm passionate about? And I'm curious how you came back to that as well.
Well, probably just I had asthma and I had health issues in adolescence, and kale and brown rice cured all my problems. So
Oh,
so
wow.
dietary changes was just important and
Yeah.
logical. It made sense, and so I was healthier and felt better. So I assumed, so that was pretty much where that started, and then. For my 9 years of training, living on M&Ms and junk food in medical school,
Yeah.
you can see, how that affects your health, and then just coming back and you mentioned root cause, and it's such a powerful, powerful um, uh, image and neglect for our profession because psychiatry is just symptomatic based care, right?
Mm.
As you said, Nicole, if you're sad, you get an anti-sad pill, you get an
Yeah.
antidepressant. If you're anxious, you get an anti-anxiety pill. There's no concept in traditional psychiatry for anything but symptomatic based care. So my career has been focused on root cause, whether it causes the illness, which sometimes it does, or just contributes to the illness, or interferes with traditional treatments, be it medications or therapy.
Mm. Yeah, and I know that Dr. Kane, you had wanted to ask about the difference between functional psychiatry and integrative psychiatry. Is that right?
Yeah. What's the difference with the language? I'm an integrative clinician, I'm a functional psychiatrist.
Yeah, it's always been confusing. That's why for many years, if you look at any talks I did, I always put both words in integrative and functional medicine for depression because
Mm.
everyone kind of resonated with a different term, right? Oh, I want to learn about integrative psychiatry, or someone went to a functional medicine workup. I think the difference is clear. Integrative medicine is focused on what we can add to augment the care for mental illness. So that would be lifestyle changes, diet, exercise, sleep, yoga, mindfulness training. And and the good news is that those have slipped into our traditional model. You can take a fellowship in medicine on lifestyle medicine.
Yeah.
Um, I'm not sure it's worth 2 years of training to know that exercise and sleep are good for you, but and there are some great trainings on mindfulness for professionals. So to me, that's the integrative world. Where there was this huge gap is functional medicine for mental illness, right? So functional medicine, looking at root cause. Why are you getting diabetes or thyroid problems or autoimmune problems or the chronic headaches? And so functional medicine became an incredibly important part of my life. And that training early on, when there were only 20 people in the room, um, and listening to Jeff Bland, but they neglected mental health and mental illness. They still do. They're afraid to talk about schizophrenia and bipolar and anything, and they lump everything under that one umbrella. So
Mm.
functional medicine is root cause, and we've started using the term functional psychiatry to help people appreciate there are objective tests to support treating someone with depression, anxiety, and ADHD, among every other psychiatric illness.
I resonate very much with that. I talked at IMMH this year about the why behind what we do to help support people. And I love that you're kind of distilling out that nuance is somebody can have anxiety. And if the philosophy or the paradigm behind that is that the anxiety is the problem to be solved, and we give them something to solve that problem, whether it's Prozac or maybe we give 5-HTP, that it's sort of like cutting off the dandelion. It's like mowing the grass, but there's still the roots there. And so then you're talking about this functional piece, which isn't so much about what we do, but why we do it. And so perhaps we do functional testing and it turns out that somebody isn't properly making serotonin because they have a serotonin, the genetic mutation that may interfere with serotonin production. And then the way we treat it, the why suddenly gets better results. And so I've learned a ton about functional testing from you, and you actually just mentioned that functional psychiatry and root cause testing. Can you expand on that just a little more?
Sure. I mean, it's the foundation of everything I've done for my career is trying to move away from symptomatic based treatment to what's going on.
Yeah.
And the most important thing I've learned, and which is challenging for both patients and for clinicians, is everyone's different. So just
Mm-hmm.
because, 8 people are having panic attacks, right? Anxiety, as you know, there might be 8 different underlying, issues to address. And that's where the testing comes in. So, we've treated panic attacks. Somebody just had celiac disease, untreated gluten sensitivity, resulting in nutritional deficiencies, and their only symptoms were anxiety and panic attacks. The next person could have been a B12 deficiency. It could have been, a hormone changes. I mean, the list is endless,
Yeah.
but that concept of looking at the individual is what functional psychiatry is all about.
What's your take on I've heard different sides and I feel like I get to talk to the OG expert here, so this is more a question for me. Is what is your perspective on periphery monoamine assay testing? And for Hadley, that's a lot of naturopaths, they'll do neurotransmitter testing. But the controversy is that your neurotransmitters, your central nervous system neurotransmitters can't cross the blood-brain barrier. They're too large. And so we also know that many of them are made in the periphery, like the gut. So the dots aren't connecting for me, but I know that there is utility. So can you talk about that?
Well, I think we're pretty much on the same page. The dots have not connected to me, and I have over the years from day one, whenever there was, the company that first came out 25 years ago, I tried it, I looked at it, I see a lot of patients, and there weren't consistent findings.
Mhm.
And then there's no research to support the neurotransmitters that we pick up in a urine test is one clinically relevant. Now, I've also seen cases where it's been consistent and the treatment has been helpful. But, as a physician, as a scientist, as someone focused on the patient across from me, I just couldn't in good faith say the, peeing in the cup is going to help me know what's going on in the brain. And there is relevance. Metabolites have been important to me. But my focus, rather than looking at neurotransmitters, is looking at the amino acids, the precursor to all the neurotransmitters in urine and in plasma. That has been incredibly helpful. And sometimes for depression, one of the most important tests that I've looked at.
Yeah. Can you talk more about that? So somebody who's in our just the general community, they're like, "Ooh, this is me. My doctor hasn't heard of any of these tests." And you just mentioned amino acid precursors to the neurotransmitters, plasma. They have depression. Where might they start?
Sure. I mean, I think I've been doing it for so long, but it's really not discussed a lot, is regardless of dietary intake,
Hmm.
oftentimes patients with depression are deficient in essential micronutrients, right? Vitamins, minerals. People appreciate omega-3s in fish oil now because that's gotten a lot of press. But what people haven't discussed enough are the breakdown products of protein called amino acids. Okay. So I have many patients who are, eating the organic meats and grass-fed products and the salmon flown in from Alaska. So they're eating all this expensive, healthy protein.
Yeah, and it's like the trendiest thing ever right now to eat so much protein.
Right. But they're coming into my office depressed.
Right.
And we do this test called looking at their amino acid levels in fasting in the morning. And guess what? In depression, they're often low. So what's happening? So they're eating adequate protein. They're eating more than enough protein, but they're not digesting it. And so some of the simplest interventions is doing this amino acid test. And then if it is low, not everyone with depression, but common, and it's been more common in women. Um, and it's we just give them digestive enzymes so they can digest the fancy expensive protein, hydrochloric acid because you need acid to break down that expensive protein, and then we give them the missing amino acids.
Mhm.
Now the good news, I've been saying it for 30 years, but it's all over TikTok, right? The amino acid, take your amino acid. So that must mean, somebody's right, but not the protein. So it's going to take a while for their body to start digesting this expensive protein, but we can give them free form, just the essential amino acids. And for some individuals, that's a core deficit that why they've been struggling. And they've tried everything, right? They've been eating the great food because they read food is medicine. But
Mhm.
what's missed is their inability to break down the acid, the protein with acid and digestive enzymes.
Mm. I think that's so important too because the it's also very in to have like an alkaline diet and acidity is bad, is kind of the zeitgeist right now, but I have been finding more and more that people are actually unable to digest things when they don't have enough acidity and to fight off parasites and bacteria and all of these things. So the hydrochloric acid is a huge piece of this.
Yeah, it's as a psychiatrist, I spend a lot of my time helping patients digest and absorb food better.
Yeah.
And there's lots of reasons why acid is low. Um, it's common, certainly as we age, and aging is like over 30 and 40, hydrochloric acid levels go down. But to make the acid in your stomach, it's a zinc dependent process.
Mm.
So we could spend hours talking about all the reasons that so many of our patients are zinc deficient, from environmental toxins to vegetarian diets. But zinc deficiency also contributes to the low acid. And then the last one I just wanted to share is stress and trauma, right? We kind of just turn off our digestive system. And what I found, particularly with women who've had stress or trauma in the past, many years later, even though the trauma is old or the stress is gone, there's still digestive system still is not working and not producing adequate acid and enzymes.
Mm.
We're in an adaptive feedback loop that was maybe useful and protective because if you're in acute trauma and stress, you want to run from the tiger or fight the tiger. You don't want to sit down for a meal. But then those feedback loops get stuck. And so what I hear is that you're able to look at that adaptation, the mechanisms the body is using systemically to keep us in that state. And then you're kind of starting to gently nudge and support those pathways. And I love that you're doing this with mental health because we're so siloed as a healthcare system. You have anxiety and depression, we're going to treat you from your shoulders up. If you have digestive issues, we're going to send you to a gastro. And oftentimes circling back to the connecting the dots is that our different experts aren't communicating and figuring out how it all works together. And so I love that in your functional work that you look at the root cause and how you may be depressed. Why are you giving me hydrochloric acid to help my depression? And you're helping people understand how it all fits together.
Right. I have a slide I've started using the last few years. It's called Anatomy 101 for psychiatrists. And it's just a picture of a neck. We have a neck, right? What happens in the body affects our brain and vice versa.
That's great.
My favorite hack, this is something I learned from my mentor. His name is James Sensenig, and he was one of the founders, the AANP, the American Association of Naturopathic Physicians. And he's always like, Dr. Kane, just make it simple. Why do you work so hard? He's like, just heal the gut, help them get some habits in place, and give them some herbs. And oftentimes, you give them some minerals and some herbs. The body can often heal itself if we just get out of the way. And he would use a tincture that was 50-50 gentian and scutellaria. And so you'd mix up gentian and scutellaria in a bottle and then give them drops of that before meals. And the constituents of the herbs can actually help the body start to produce its own stomach acid, help it produce its own enzymes. It's a carminative. It also is, the scutellaria is really good for stress-induced gut symptoms. And so people are taking just a few drops, 5 to 10 drops of this plant before every meal. And they're like, I don't know how something so small can make such a big impact, but I like to remember that to keep it simple in many ways.
Yeah, no, it's really important. It's a great point because I think our integrative functional community has pretty much gone the way of our traditional medical community and just throwing supplements at individuals or treating lab tests. The amount of labs that people are using um, are expensive and overwhelming for patients, and the amount of supplements. So I really like that image of trying to keep it simple, and that's sometimes challenging with complex patients, but it's got to be our goal.
And I loved how in your book, the one about ADHD, I have been listening to it, and I love how you are like, well, you know, you might need to do testing, and if you're not able to do all of that testing, let's start with this thing, add this thing, subtract this thing, add this thing, subtract this thing, and starting from just like very small things that you can do to see if it helps. And I feel like that's just so accessible for people.
Yeah, it's really important. I mean, the functional medicine world is expensive and kind of not equitable in terms of who can afford it, and that's a tragedy. Getting a little better, but there are simple steps of routine testing covered by insurance or based on clinical symptoms, some interventions that doctors could utilize to help patients struggling with depression.
Absolutely. Yeah. And I know we also wanted to talk with you today about eating disorders, and specifically anorexia nervosa. And that this has been something that has been a huge part of your career. So I'm curious, what have you kind of discovered has been helpful for people outside of the behavioral therapies and that kind of thing for eating disorders?
Well, that's a 6 hour question. And it's been my career for 25 years now. And in my training, I'll try to summarize the 6 hours in 5 minutes, I promise. My training, I treated eating disorder patients and I said I would never do this for a living. I mean, because they're challenging and we had no treatment, right? As a psychiatrist, I have no meds that work, I have no therapy that works, and it's a life-threatening illness. So both myself and all my colleagues say we're not going to do that. We want to help patients. So we're going to treat depression, anxiety. And so I ended up on an eating disorder unit by accident. I took a job as a chairman of a psychiatry department, and we had a small eating disorder unit, 7 beds with anorexia. And it wasn't always full, so we might have only had three patients at one time. And when one of the doctors went on vacation, I had to cover the unit, and I kind of was exposed to an incredible life-threatening illness that no one knew how to treat. And that was my introduction. And it's been an incredible journey, pretty sad because I've watched too many individuals die.
Mm.
But it really has kept me in traditional psychiatry because my interest is nutrition and brain function. And I was working with a group of malnourished individuals. So early in my career, 20 years ago, it was okay to talk about zinc and fatty acids and B vitamins and magnesium to my colleagues at academic medical centers or grand rounds because I was talking about anorexia nervosa, a disorder of starvation. So that's been the gift for me that I stayed in traditional medicine as an expert in eating disorders, so I could help bridge those gaps. But what it did for me, it just enabled me to see up close what malnutrition does to the brain. Think about it. A disorder of starvation and malnutrition, we have highest rates of suicide, depression, anxiety, delusional thinking, and those all disappear when they're nourished. And my whole issue was the eating disorder community then when I started, and today focus on calories, restoring weight, not micronutrient deficiencies. So my work has been understanding and trying to educate people on, I think the core deficiency in anorexia nervosa is zinc with a genetic vulnerability, and obviously fat. It's a fat deficiency disorder. Many of these kids have avoided fat intake for years. The brain is fat. Then all the other micronutrients that, we talk about in every other disorder, magnesium, but it is a disorder of malnutrition. There are many, many reasons why kids might restrict their intake, or adolescents or adults restrict their intake of food. But at some point, it becomes a disorder of malnutrition. And our current treatment model doesn't treat the micronutrient deficiencies.
And then people can feel so unwell when adding those nutrients back in. I've seen people who their body doesn't do well. They've been in starvation for so long, is adding that back in, like zinc, for example, can cause a lot of stomach upset. So
Mhm.
how do you help patients to overcome that so that their bodies can start receiving those nutrients?
Sure. I mean, I think the punchline is slow
Yeah.
and low doses, but the zinc deficiency, as we said earlier, is part of that GI upset because they can't make digestive enzymes, they can't make hydrochloric acid. So we give low dose zinc with food and slowly titrate it up, and the omegas and the B vitamins. We do it slowly, but just calories and our current model is we're giving patients junk food on the inpatient and residential treatment programs is just not sufficient. So you're absolutely right. It's a slow process, but without those micronutrients, relapse rates are high, mortality rates are high, and recovery is just a very, very kind of poor outcome.
Yeah.
Yeah, and I'm curious about so kind of like the chicken and the egg thing. So you mentioned that, when we are restricting and, severely restricting nutrients, um, that's going to cause issues in the brain and all of that kind of thing. So do you think that the zinc causes the restrictive behavior in the first place, or is it because they were restricting and then that has, effects all down the line, or both?
Both. Yeah, yeah, absolutely. So we can take a couple scenarios, from either someone going on a vegan diet at 12 and
Mm.
because they don't want to hurt the cow, or for whatever reason. And then in adolescence, you have a higher need for zinc to get through puberty. So between puberty, stress, life, and not eating meat, they become zinc deficient and their appetite decreases. And then it's a chronic cycle.
Wow.
Zinc deficiency, they don't taste food very well and they get bloating, and then they have no appetite. And there's also a phenomenon of a distaste for meat as you become zinc deficient. And
Oh,
for others, it's the opposite. But I think for eating disorders, genetic vulnerability, or for all of our psychiatric disorders, some of the most important questions I've asked is 3 generations family history and understanding what aunts, uncles, and grandparents were doing and saying and feeling. So there's a genetic vulnerability. Obviously, not every vegetarian is going to be zinc deficient, but some will. And that genetic
mm.
vulnerability, then that restriction for many results in that chronic cycle of eating disorders.
Are you seeing a pivot in that in a post-COVID world where everybody was just pounding zinc?
I've seen it actually for even before COVID when parents were treating their autistic kids with zinc and men were treating their prostate with zinc. So
Yeah.
yeah, too much zinc, like every other micronutrient, causes imbalances. And with the obsession with zinc for years, people had low copper. So I would see people
Mm.
coming in the office with depression and lack of motivation because they were taking zinc for years and nobody checked levels or stopped it. So absolutely, there is a kind of a backlash, and we have to appreciate the role of micronutrients in balance and in kind of perspective.
So there's a micronutrient that you talk about, and I think it's brilliant. And I've been getting, over the past 5 years, calls from people all over the world asking about this micronutrient. And I think by and large, because of your research and your writing, is words getting out. And it's lithium orotate. And you wrote this beautiful book about it. It's a Cinderella story. And so I was curious. The first part of the question is a two-part question. The first part is, why is lithium orotate so marginalized, especially in European countries? For example, a woman in Portugal called me and she's like, it's illegal here. None of the doctors will let me use it. I can't buy it here. I have to get it. I have to go get it abroad and then go back. And the second is, what is lithium orotate and how can we help people understand if it's valuable for them as a micronutrient or not?
Okay, my favorite question. Thank you.
Yeah.
Um, so lithium is a natural element. You can look at the periodic table if you remember your chemistry class. It is in the Earth's crust. It's been around for day one, so 4 billion years ago. And it is an essential micronutrient like magnesium and zinc and copper and potassium and iron for human health, lithium. What we think of, or what most of us and many of your listeners will think of lithium as a medication for bipolar disorder. And they might also know someone who had high doses and had side effects, or even kidney damage due to lithium. So there's lithium as a medication. There's lithium as an element in the Earth's crust that we're mining and using in our computer batteries, our airplanes, our cell phones, our technology cannot function without lithium ions. Okay, so we use it. Lithium as an element, lithium as a drug. My world, even when I was in medical school, I learned from Jonathan Wright, a physician who really was kind of the founder of this integrative medicine movement. I learned about lithium orotate when I was in medical school. And it is just a kind of between the element, which is in micrograms, versus the medication. So I've been prescribing lithium orotate for 30 plus years at tiny doses, 2 milligrams to 30 milligrams. And it's been essential for many, many clinical issues I'll get to in a minute. But I just need to say that my life changed dramatically August 2025 when a group out of Harvard published in Nature magazine, a very prestigious science magazine,
Hmm.
that lithium prevented Alzheimer's in both mice models as well as lithium was deficient in brain biopsies they did with normal patients versus patients with Alzheimer's.
Mm.
So I've been kicking and screaming with a few others about lithium orotate for 30 years. And as you mentioned, Nicole, there's been people in my community saying it's dangerous, because they don't know anything about it. Even though we're talking about the amount that some of us would get in our diet or in our water supply. But that study was so dramatic, had such profound implications that lithium orotate, one, prevents and can reverse the pathology of Alzheimer's, and two, that it's essential micronutrient. So that's the Alzheimer's literature, and we have books and courses to describe it. But my work as a psychiatrist, that I use this low dose lithium, 2 to 5 milligrams, for treating disorders that have to do with irritability, impulsivity, and kind of mood lability. And think about that for a minute. I mean, that's a lot. That's ADHD, that's addiction, that's depression, that's anxiety, the personality disorders, borderline personality disorder in particular, one.
Yeah.
Um, but most of my work is around ADHD and irritable, angry um, individuals who are trying to come off alcohol. And lithium orotate has been one of the most important parts of my practice across many psychiatric disorders.
What are your top cofactors for lithium? So in terms of helping it, so people will often take these singles and then they'll get better, better, better. But if they're not giving the cofactors to make sure those pathways are going, then after several months of use, they might not notice as much benefit or feel worse. So do you have cofactors that you often recommend with lithium?
So not with the lithium, but you're absolutely right. I see all the time people get excited and they take lithium and they have this dramatic response. And then 3 months later, things creep back. And almost all the time I've seen that it's because they haven't dug deeper. It's not just a lithium deficiency. They didn't realize the patient had celiac disease or B12 deficiency or 100 other things, hormonal imbalance. So I really don't think it's one factor. So it's really that digging deeper for root cause that gets missed. But if lithium is part of that equation, and I've made comments that I've gotten the most thank you notes from spouses, parents, teachers, and colleagues by using this low dose lithium.
That's awesome. Hadley, I'm thinking about your Pitta clients. So
I am
Uh,
too.
yeah. So Dr.
Totally.
Greenblatt Hadley studies Ayurveda and she does coaching and she does a lot of nutritional work and habit work. And are you familiar with Ayurveda medicine?
The big picture, yes, not the details,
Yeah.
but yeah, no, I know the language, but I can't speak it, right?
Yeah.
Yeah. Well, had so you're thinking Pitta too. Can you explain just like really briefly? Because we have to incorporate your Ayurveda into this.
I love it. Yeah, I was just thinking about, so you're mentioning irritability, anger, volatility, that kind of thing, is in Ayurveda. There's the three different doshas. One of them being it's called pitta, but it's basically like the fire element, essentially. And so people can have an imbalance of any of the doshas, but a lot of times people are born, everyone's born with like one prominent one, maybe two prominent ones. And so people who are more susceptible to having the fire element, I'm just thinking about how lithium would potentially be super helpful for them. Um, in conjunction with a lot of the other nutritional changes and stuff that they need to make. But yeah, my mind was spinning about like, I wonder what the qualities of lithium are that would help to decrease the anger and that kind of thing. Because in Ayurveda, it's all about qualities where it's like, okay, the quality of pitta is fire, is hot, is dry, is heat. And so I wonder about the qualities of lithium and if it's like cooling and potentially wet and those kinds of things. So yeah.
Well, I think it's the softest metal on the planet.
Ah,
Um,
there you go.
but
Yes.
I'm confident that it would help. Um, and the lithium orotate was just proven. Um, so that's great. But something else I've been saying for many, many years, which might tie into this, is I'm quite convinced that there's a lithium deficiency that people get, and based on their diet and their genetics, but there are also a group of individuals that, like every other micronutrient, have a higher need for lithium.
Mm.
Mm.
Okay? I mean, we know that for every other micronutrient, someone can never take a vitamin D pill in their life and have a level of 42. And there are
Mhm.
others who are taking 5,000 units and they can't get their level up at 20. So we understand the genetics of that. We don't understand the genetics of lithium metabolism, but I'm confident, although I have no research to support it, there are in my world, there those family histories of addiction,
Mm.
those family histories of anger and violence.
Which addiction is also a lot of times a pizza, like there's a pizza all or nothing thing
Yes.
Mm.
going on. Yes. Yeah.
So even though maybe the patient in front of me might not be an alcoholic, but their brother and their uncle and their dad struggled with alcohol, I'm quite confident that that individual who's coming to me for depression or irritability would benefit from lithium. So I do think there's this genetic need for higher amounts. And that's why, I focus on these lower dosages. And I think people are, I think, overdosing the lithium orotate, just taking 10 and 20 and 30 milligrams because, right, if a little helps, then more is
Yeah.
Mhm.
better.
Well, and if you
And
have a lot of pitta, you have the all or nothing tendency. So you're like,
exactly.
oh, it must be so good. Yeah.
So we get about 2 milligrams average in our diet, a lot of it from our water supply, but nobody's drinking tap water anymore. So there's some in our food, but it's been mostly through, the entire human race. It's been in drinking water because it leaches from the rocks into the water. And we don't do that anymore. We're filtering it. And then those families, uh, with that genetic predisposition. It's either depression, addiction, aggression, violence, impulse control. So there are a lot of different names. Not everyone was diagnosed, but Uncle Johnny was in prison and Aunt Susie had an anger problem. But to me, those are lithium deficiency
Mm.
genetics.
That's
So now
brilliant.
I'm going to look up the PETA.
Yeah.
Yeah, yeah.
Totally. Yeah. No, it's fascinating. Everything that you're describing that it helps is like, oh, it's all pitta. So,
Yeah.
yeah.
Yeah. And that's wonderful too, because then it allows your why to inform them about what might be helpful. So, for example, I had a patient in yesterday and he had been taking tons of turmeric all summer in Michigan.
Mm.
He couldn't figure out why he was irritable and why he felt like his muscles were really tight and sore and he was clenching all the time and he had reflux. And I was like, well, maybe you're overheating yourself and you're pushing
Mm.
yourself into a pitta state. So it's like maybe we switch you to something cooling. If you want to bring down
Mm.
inflammation, let's do something cooling, something anti-inflammatory that's cooling.
Mm.
And he was like, that was the best change I ever made. Who knew that stopping turmeric
Wow.
would be so helpful? And
Mhm.
I was like, well, the why is different. The turmeric in and of itself is wonderful. And for you and your unique constitution, like you were saying, Dr. Greenblatt, is your unique composition of symptoms is it wasn't the right match. And so I love that precision
Hmm.
medicine that Ayurveda allows us to ask more questions to get more precise with what's going to help the body do what it does best is heal.
Absolutely, yes.
That's so
Yeah,
fun.
I was just talking to someone who was experiencing like lots of anger, irritability. She's like, "Oh my gosh, I've just been so angry lately." And then she later on in the conversation, like an hour later, we were like at a party or whatever, and she's like, "Oh yeah, I just eat cinnamon all day, every day. I put it on everything. I put it in my tea. I put it on this, that, like multiple times a day." I'm like, "Oh, okay. Well, maybe let's decrease the cinnamon. Maybe swap it out for some cardamom because that's cooling, whereas cinnamon is very, very heating." And she was like, "Oh my gosh, I didn't even think about that." So it does those kinds of things make huge differences for people.
That's so cool. So I know we're coming to the end of our time, and I always love to end video interviews with rapid fire questions and then the thing that you're most excited about that you're working on right now. And so I kind of want to start with that one because you have a book coming out. Yes?
Yeah, I have a book similar to the Finally Focused on ADHD. This is called Finally Hopeful, for the treatment of depression. So it's a functional medicine approach from the amino acids we talked about to simple vitamins, to dietary changes. But the focus is really functional, so people can help their doctors look at testing and just not guess, either with supplements or meds. And an important part of this book is a section on antidepressant withdrawal and how to help people taper off antidepressants.
Oh my gosh, I can't wait to read it. When is it coming out? When's
I should be out
published?
in first week in January. I think January 13th is what they tell me.
January 13th. All right, everybody, go and or you guys are doing pre-orders, yes?
Yes, I think that's available.
Yes, so please pre-order this book, Finally Hopeful. I've
Mm.
read many of your other books. I think they're wonderful, and this one sounds like exactly what we need in this time in our healing human history. So thank you for writing it, and we'll make sure to include the links in the show notes and all of that. And then how can people get in touch with you and your team if they want to learn more about the work you're doing?
Sure. My website is jamesgreenblattmd.com, and that's where we have the books, and we have some consumer courses for individuals who would rather listen than read.
Yeah.
So there's anorexia, there's ADHD, and then depression we'll be putting up in the next month. And then my professional platform is psychiatryredefined.org. So that's where we train doctors and clinicians and naturopaths and um, psychiatrists in this functional medicine for mental health. And there are courses and webinars and a year-long training program.
Yeah, and I can testify to how they're so good as a professional. They're really wonderful, really jam-packed with a lot of very specific studies and dosing, and the whys is brilliant. So thank you for doing all that work for all of us.
Hmm.
All right. Rapid fire questions. So these are intended, I'll ask you a question and then you could give maybe like a 1 to 2 sentence of your thoughts and opinions. And so for those who are listening, I would love to hear what you think. Do you agree? Do you disagree? Tell us what you guys think. So we have the expert here, so I'm pumped to hear what Dr. Greenblatt says. So first question is, what do you think about the carnivore diet?
A potentially helpful tool, not a long-term diet.
Beautiful. And on a similar thread is, what about intermittent fasting?
Potentially helpful tool with some conflicting research now. Um, not less concerned about a lifelong pattern than I am about carnivore diet.
Beautiful.
Mm.
Lots of people have been hearing about meta-inflammation, inflammation in the brain, and they want to help bring down inflammation in their brain. They want to know what the top 3 things they could do or take is. What would you suggest?
I would say the first two, I have to say, is find the cause,
Uh-huh.
right? I mean, whether it's a chronic infection or stress or trauma, I mean, there are 100 things that creates inflammation. By just putting Band-Aids on it and taking turmeric and magnesium, it might help, but you want to get to the cause. So
Mm.
I would say that's one and two. Number three probably would be, omega-3 fatty acids.
Amazing. Uh, Methylene blue has been in the news quite a lot in 2025, which is when this conversation is being recorded. What is your take? Should we all be drinking the blue dye? And if not, why not?
I started reading and then I've avoided jumping into it, so I have no opinion.
Perfect. And a lot of people are asking too about the electron transport system and if there's anything that we can do to figure out if electron transport system might be part of our symptoms. And if so, how do we test it and what do we do? That's a big one.
Yeah, I mean, I've one of the core tests that I do is the organic acid test, a urinary organic acid test. So we look at metabolites and can help better understand mitochondrial function. So for most of our patients with mental health challenges, absolutely CoQ10, B complex, magnesium, and amino acids are usually part of the treatment.
I love that. Just a couple more is uh, oral microbiome as it pertains to the brain. Do you think that this is something that psychiatry should be pursuing more, or do you think that it's a little bit of an overreach?
I think any discussion on the microbiome is not an overreach. I just heard a presentation on a dementia and gut microbiome. So whether it's in the mouth or the gut or any other part of it, it has tremendous potential and implications for mental health and mental illness.
I love that. And there is one more question, and it's if you could only change one thing in your lifestyle to improve mental health and brain health, what would that one thing our listeners can start to do today?
I think it has to be related to stress, coping with stress, stress reduction, taking that time because I learned that I went to medical school. Can I do another sentence? And
Yes,
there's an
yes.
acupuncturist, Diane Conley, who wrote a beautiful book on the five element theory. So this would
Yes.
have been the 80s. And at the time, I was in my brown rice and kale phase. And she gave a lecture to the medical students. And she said, I'll never forget it. She says, I don't really care what you're eating. It's how you're feeling when you're eating. And I just, didn't really make sense at the time, but I never forgot it. And to me, in my practice as a consultant, I see a lot of people just obsessed with health food and they're doing their exercise and yoga and doing everything right, but they're not mentally well. So I think the stress reduction, the ability to appreciate your individuality and whatever it takes to focus on that in terms of modulating stress. Doesn't mean don't work because some of us do better working. That's our stress reduction. But understanding how stress affects your life and your brain health, I think is the number one thing I've learned.
Okay, I feel called out by that. Can I just confess? This is my confession. I had a very stressful week on Monday. Somebody drove their car into my building. into
Whoa.
Yeah, it was thank gosh nobody got hurt, but they like drove through the building into a treatment room. A patient was receiving acupuncture on the table. Everybody was okay. But I got home that night after like taking care of all the things that I needed to take care of. And I was like, this girl needs some salt and carbs. So I made a batch of Chex Mix and I just stood at the counter and I just stress ate Chex Mix. It had like probably, I don't know, my, I don't know, so much salt, so much salt. I should send you some. You'll have to drink gallons of water because it's so much salt. But maybe it's less about the volume of Chex Mix, but more the combination of I'm standing at the counter horking down Chex Mix as a
Mhm.
way of coping with someone driving through my building.
Totally.
Maybe.
But you did what you needed to, right? Versus yeah. So you modulated your stress.
I received that. Dr. Greenblatt said that I modulated my stress with my carb loading that day. And so I
Anything can
received
be medicine.
anything could be medicine. Yeah. This has been such a great conversation. Truly, I'm just delighted that we had the time to get to connect with you, promote your book, share your work, spread the word, pass the baton on to the listeners. I really am very sincerely grateful.
My pleasure. Great talking to you, and really appreciate the opportunity to speak with your group.
Thank you
Awesome.
so much.
All right, everyone. Thanks for listening to Holistic Inner Balance. If you loved this conversation, please like the podcast in your app, write a little bit of love if you are so inclined, and definitely share it with your friends. Dr. Greenblatt is one of the trailblazers in the field of integrated mental health, functional psychiatry, functional medicine. You definitely need to get his book. And so I'm curious about your thoughts, your questions. Did you agree with his thoughts and opinions on our rapid fire questions? Let us know. And we can't wait to hear you guys and what you think next time. So we'll see y'all later.
Bye.
So then we edit out for my video editor, and that's a wrap.
Great.
Thank you,
Well,
Doc.
thank you. Very nice talking to both of you. I really appreciate this.
Yeah,
Yeah,
truly.
thank you.
And we'll
And
have to connect in person. I know you had another, I'm on your email list, so I'll have to get to one of your conferences. You guys are doing another one, right?
I'll be at a couple. Where's your practice, Nicole?
I'm
Where
half
you?
the year in Michigan and half the year in Phoenix. So we're going to Phoenix now because it's cold.
Good thinking. And
Yeah.
Hadley, where are you?
I'm in San Diego.
Oh, you're in? So lucky you. Okay.
Yeah.
Yes. So
Where are
lucky.
you?
I'm in Boston.
Okay.
I'm making, some warm plans. Um, in December, we got a conference in Anaheim, LA. So,
Oh,
um,
great.
December.
and then hopefully, I had a great 10 days in San Diego
Yeah.
Yeah.
under the Coronado.
Oh, yeah.
Uh-huh.
It's the
So,
Uh-huh.
best.
so we're going to try to head back there.
Nice.
Good. We'll be there.
That's great.
We'll definitely be there. I'll for Hadley, you just get on his email list. I'll forward you one of the emails you could send us.
Perfect.
Yeah.
Yeah. That
Great.
sounds
All
Have a
right.
great.
nice day. Thanks again.
Thank you.
Thank you so
Bye.
much.